Hi everyone, my name is Dr. Razali and
my name is Dr. Rosli.
And we are from
CVSKL.
the best place in town.
We actually have some questions for the World Heart Day that we hope we can address and keep you educated, informed.
So the first question, Rosli.
Okay.
True or false? The pain in my legs must be a sign of aging. I'm sure it has nothing to do with my heart.
That's not entirely true, Razali, because sometimes it might be due to a term we call as peripheral vascular disease. You have blockage in the blood vessels to the heart. You may actually have blockages to blood vessels that supply your leg. And this causes pain when you walk. And this might limit the activities that you are able to do.
Right, so don't just ignore when you have pain in the legs and attribute to aging, especially if you have diabetes and heart disease. So,
I've got a question for you. True or false? Atrial fibrillation is just a harmless heart irregularity. Is that true?
Absolutely false. But I need 1 hour just to expound on this. And I've been saying this again and again. Atrial fibrillation is not a harmless disease. When we were medical students, about maybe 2-3 years ago,
somewhere there.
and we were taught that atrial fibrillation is basically an aging problem, harmless. No, atrial fibrillation can cause death, mainly due to stroke and heart failure. So don't take atrial fibrillation lightly.
Let's go to the next one.
And this is a question for Dr. Rosli. What is the link between smoking and heart disease?
There are a couple of factors that are considered as risk factors, whereby if you have it, it increases the risk of getting heart disease. Smoking is definitely one of the major risk factors. And it's quite a shame because it is something which is preventable, and not just heart disease. There's also stroke, peripheral vascular disease. And women tends to be affected much higher than men. And so this is something that we need to remember. And what is also interesting that if you stop smoking, that risk of getting a heart attack or stroke will be rapidly reduced after about a period of 4 to 6 months.
What about vape? Is that carry the same risk?
Yeah, if let's say the vaping is, you use the same compound as with cigarettes, of course, the risk is still there.
So no smoking and no vapes as well.
All right. So, true or false? My heart is beating fast. I must be having a heart attack.
Well, that is both true and false. I mean, one of the signs of heart attack sometimes is the heart beats fast, and it's called ventricular tachycardia. And in fact, a small percentage of patients with heart attack actually drop dead because of sudden cardiac arrest. And sometimes after it's been managed and seen, and we find it wasn't a heart attack, then we will be able to recognize and be able to diagnose what sort of fast heartbeat that you have. So the right answer would be, if you have fast heartbeat, don't wait. Go to the emergency room, to the nearest hospital to get it sorted out.
Okay, another one for you. True or false? Diet doesn't affect atrial fibrillation.
Diet doesn't, no, in a way, and this is very, something relatively new. One of the main reasons why there's a sudden epidemic, in fact, pandemic of atrial fibrillation before this COVID pandemic was the pandemic of atrial fibrillation. And my colleagues in Australia have shown that by putting patients on a very strict diet and they lose weight, it can improve their atrial fibrillation. So nowadays, the treatment, just like when you treat coronary artery disease, it has to be a holistic treatment. If he's overweight, ask him to lose weight. If he's got sleep apnea syndrome, make sure that that's being treated. Control his blood pressure, control his diabetes. Then you intervene and ablate or put a stent. Then the patients will do very well. So yes, diet does affect atrial fibrillation.
All right. Okay, Lee.
This is for you.
Yes.
Heart disease is a man's disease. True or false?
Oh, absolutely false.
False.
Obviously. Women always tend to think they will die more because of cancer. That's not true, because women in Malaysia, the risk of dying from cardiovascular disease is 2.5 times more than getting cancer. You've got to make sure that you have a checkup to see that you're not diabetic, cholesterol, you don't smoke, and so on and so forth. And if you do have all those risk factors, have them treated.
So, time is so short. I wish we can have 1 hour to talk about this, but I hope that you have enjoyed our take on some of the frequently asked questions. And I hope that all of you stay safe. All right, guys. Bye-bye.
Thank you very much.